Welcome to the Glow Zoomcast. I'm here today with Yael Borensztein of Root and Spark Birth Support Services. They offer lactation consultations, birth education, and doula support, both during and after labor. And Yael is also a registered nurse practicing in New York City. She specializes in postpartum recovery and support. And today she's here to speak with me about what doula support looks like in the time of COVID and how the laws across different states and the changing laws are impacting doulas, both in their health, safety, and the way that they're serving their clients. Yael, welcome.
Hi, thank you for having me.
Tell us a little bit about what your experience has been like as a doula in New York City over the past 8 weeks.
It's been a lot. It's been like a lot of rapid changes that we adapt to and then we have to adjust. Just to give like a sense of the trajectory, one of the first things that happened when COVID started to hit hospitals was that support, like the number of people that you could bring in with you to your birth at a hospital started to get limited pretty dramatically. So first it was only partners were allowed, no extra support people. So that's when we as doulas had to recognize that we were not going to be able to be physically present for births in hospitals. And then the next thing that happened, which I kind of foresaw having been in hospitals as a nurse, was the limiting of even partners being present. So people were going into hospitals to give birth on their own without any support at all, which was really heartbreaking and scary. And then just not long after that, the Governor Cuomo issued an executive order saying that partners had to be allowed in. Not just partners, but one support person had to be allowed in, that birthing people will not be alone without any support. And then that was the case for a few weeks. And then about 2 weeks ago, I have to admit my sense of time right now is very warped, but I think it was about 2 weeks ago, there was a second executive order that came through saying that hospitals must allow a second person, that doulas were considered an essential member of the support team or the healthcare team for births. So that kind of disrupted a lot of how we've been thinking about it, because we had been really effectively modifying the care that we deliver to a virtual model. Mm-hmm. And now we're kind of all over the place as far as who does virtual, who goes to hospitals in person. And it's complicated for a lot of reasons. And it's, I think, confusing to families who don't really know what to expect. And it's difficult for those of us who are trying to make a living and make sure that we can still support the families that we care about as things change all the time.
It sounds so complicated. I want to take us back to the time when these announcements were first made, and you guys as doulas, so you were already working in the hospitals as a nurse, you were seeing how the lack of PPE and the lack of any kind of stringent order and stringent rules was putting you guys as nurses, as medical practitioners, in danger. And of course, if the medical practitioners are in danger, that also means other patients are in danger. And in the field of birth, one of the realities that I think a lot of people don't think about is the fact that it's the only thing you're going to the hospital for that isn't a malady. So you're showing up there and there's not something wrong. You aren't sick. You're not there to be treated for anything that's wrong. You're just there to sort of have a normal process monitored in case something is to go wrong. In the best of circumstances, that's what you're doing in the hospital. So now you have people who might not necessarily have a comorbidity issue going on. So they're not coming in already being treated for, a cardiovascular issue or something like that. But now you're putting them in who they're already going to be in a vulnerable state. And now on top of that, you're exposing them to more, to a very different microbiome than they are used to. What did that feel like when you started to think about how the doulas in your community were reacting? You're now a doula and you're a nurse, right? So you have this, you're wearing two hats and you're looking through two lenses simultaneously. What did that feel like to you?
It was like I was feeling like a tug of war with my conscience and my logic and my different communities. I was feeling, one of the main things I was feeling was all the things that you just said. It was like, we've been saying as birth workers, as people who work in the community and support birth in hospitals, we've been saying for a long time, like, it's pretty wild that birth takes place in a hospital, given that it's the only thing that people go to hospitals for when they're not sick. So a lot of what we do as doulas is reminding our clients that they're well and that they're healthy and that they're capable and strong, and that they don't, once they put that hospital gown on, they're not sick. Like, there's nothing wrong with them. And I think it was interesting to see the whole world have this realization that we've all had. And to be clear, hospital support for birth when it's necessary is so important and so valued. But we have come to a place where we're providing hospital, like, medical care to support a very normal process in a way that's disproportionate with all of the other methods that we have with midwifery care, with out-of-hospital birth centers that are better set up to support a normal physiologic process. So I was first like, oh, wow, people are kind of realizing this thing that we've been talking about for a long time. I was also feeling very protective of my coworkers in the hospital. I was feeling, I was seeing how there were a lot of doulas in the community, and a lot of doulas like to, like, rally. We like to kind of, like, show up and be activists. And a lot of times this is great. And a lot of times we just kind of, like, move ahead without really, like, checking ourselves, I think. And I was having some frustration around the fight to get doulas in hospitals at a time where I was worried about the health and safety of my nurse colleagues and my doctor colleagues and all of the hospital employees that I work with, who didn't have a choice in showing up or not showing up, and who didn't have adequate protection for themselves, and knowing that any extra people going into hospitals are going to increase the risk for them of maintaining their own safety, and also the health and safety of all of the patients in the hospital. So I was feeling like I needed to be very clear to my community of birth workers that it is so important that we continue to support our families, but that it is time to adapt, because these are extraordinary circumstances. And we can't go into this expecting that things are going to look the same or feel the same, or that we're going to have the same outcomes, which was the tug of war that I was having, because I think all families deserve physical support and love and evidence-based care from anyone that they want to have present with them, which in our community is doula support. So it was very hard for me to say, like, I'm not showing up for my clients in that way, but I'm having really meaningful and honest conversations with my clients about why and what that looks like, and how I'm protecting them, and how I'm protecting myself, and how I'm protecting the hospital in doing that. So that was it was tough. It was really confusing and conflicting relative to everything that I've felt and thought for throughout my career. And then it became frustrating, because we all started to create these really wonderful virtual support programs, and we really started to get comfortable being on the phone with clients, FaceTiming with clients during labor, checking in, developing really flexible and comprehensive ways of supporting people during their pregnancy when we're not doing in-person visits. And then when things shifted to allowing doulas in the hospital again, which was a couple weeks ago, everyone got really excited that now they can go to hospitals again. But the reality is that nothing has changed. Nothing has changed around how this virus spreads, how sick people get, how much PPE there is for the hospital workers, how much testing we have to make sure that everyone is safe. We just don't have that yet. And there are hospitals that are testing doulas, but that doesn't mean that we know before we go to someone's home whether we're positive or not. When we go to do in-home labor and labor support before we transfer to the hospital for birth, we don't know. That doesn't do anything to stop us from going from one hospital with one client to another hospital with another client, to someone's home, to our homes, to our families. It just, nothing has changed there. So I'm really struggling with how to manage expectations and how to best deliver care, despite what an executive order might say is okay or should be.
Yes, that makes perfect sense why you would be both confused and feel threatened by that. It makes me immediately think about how paralyzed people feel at the thought of having to go into the birth experience without support that is theirs, that they hired, that is going to be their personal advocate, which then makes me think about the travesty, if I can use a big word, that is the current state of birth in a lot of countries, a lot of developed countries, especially who have such comprehensive medical care in so many other parts of medicine, but in the maternal health field still have such a massive gap in the way that the care is delivered, matching with the way that the care is perceived and received. So whether that is measured against actual birth outcomes or just with the mental health outcomes and what people describe as birth trauma ultimately. So how are you preparing your clients when you're talking about it with them virtually, and how has that changed from when you kind of knew you could like swoop in with the cape on and be like, don't worry, I got this?
Well, first of all, I think one thing that has always been kind of at the core of the type of support that me and my partner Elizabeth provide is that our philosophy is that doulas, like, we are not essential to your birth. Even before the conversation about essential workers, before the pandemic, before we ever thought about these things, we always interacted with our clients and approached our clients from this, with this idea that, like a belief or a core value, that we are wonderful additions to your experience, and we want to do everything that we can to make it as positive and joyful and safe as possible, but that we believe in the ability of our clients, and we believe in their strength and their intelligence and their capacity in the same way that they are in every aspect of their life as adults who have formed a family and made a person in their belly. We don't take any of that away. We want to remind them that that's the case. So now that we are having conversations with our clients about not being physically present, we remind them of that, because we've been clear with them about that from the beginning. What I want to be clear about, though, is the people that hire my practice are generally affluent people who have high levels of education. I don't want to say that they're mostly white, because our client base is not, but it's a different category of client than the people who are actually most adversely affected by the maternal healthcare system as a whole, but also during this pandemic. So we can talk like that to our clients. And I think this is still true for everybody of every race, of every socioeconomic status. I believe in their capacity to show up for themselves, and that they don't need us. But that's also part of the conversation we have with those people who are hiring us, which is that, like, you're going to be fine. Like you have us in your pocket. We're here for you. We're going to keep talking to you. We're going to give you access to all the resources and information and support that you need. We're going to be a little voice in your ear during your labor and birth, but you're going to be fine. What I'm worried about right now is why this healthcare system has decided that doulas are essential in reducing all of the negative outcomes that disproportionately affect Black women, especially, but women of color in general, birthing people of color. So I can have these conversations with my clients about showing up for them and about what that looks like during this time. But to be quite honest, I don't have a lot of patience for people who aren't really thinking about their privilege in the healthcare system and in their birth experience versus others who don't necessarily have access to doula support to begin with. So how can we focus right now on getting support to people who do benefit from doula support in a much more critical way, but also why are we being looked at doulas as essential to solving this problem that's a system-wide problem, that's a institutional racism problem, that is an inadequate spread of resources, allocation of resources problem. And we're expected as doulas to show up with our cape and solve this problem. And
to be underpaid the whole time. And
right.
Nobody, if you were to take the average fee for a doula, we'll talk about the Medicare fee for a doula in a moment, but if you were to take the average fee for a doula and then divide that by the number of hours that a doula is going to be in person with you or virtually with you in the COVID era, you would never think to try to pay somebody that little per hour, right? If you think that a normal labor is about 24 hours long, plus if you're doing prenatal and postpartum visits, you would never, offer that to somebody.
Being on call, not being able to travel, not being able to, not that now we can travel anyway, but generally not being able to leave where your clients are, having to know that you can potentially drop at any time and run to a birth. Yeah, we are undervalued for sure.
And so the reality is that there are sort of two issues here that are both super, super interesting, super important, and troubling. The first issue being like the larger systemic issue, which is that at this point, what the United States has done, much from the pressure from the press and from doulas, in fact, and from communities who are rallying together against the abysmal birth outcomes that we have as a nation, especially for women of color, for people of color. What we're seeing is that they've added this layer into the system that is primarily privately paid. So they've actually now layered this in as a burden to the patients, right? The citizens, and that's the doulas. They've layered this in to make things just even more complicated, while at the same time not empowering doulas. So doulas are not stakeholders in the larger system in any formal way. And then you have this other issue that issue is present, is ever present. It doesn't matter whether there's a pandemic or not. Now, this other issue that we're having is that it also, as professionals who are not protected by any governing body, they're not protected by any union, they're not protected by any employer, because even if you are a doula who's working in a collaborative or with an agency, you're a 1099, so you don't even really have a technical umbrella or a safety net. You're certainly not employed by the hospital, and now and a lot of doulas are actually volunteers, so they have nothing to support them. Now these doulas are being asked to go in and risk their own health as essential workers because they are going to be getting pressure from people, especially people in a place of privilege, who are like, well, I'm paying you, and you are allowed to come in now. So now the expectation is that you will come in. And it sounds like it puts doulas at a disadvantage just in terms of their own healthcare at this time.
Yeah, it's the things to consider. When Elizabeth and I sent out correspondence to all of our clients around why, despite the executive order, we're still not comfortable going to hospital births. We made a clear list, and one of the things on that list is that if something happens to me, I don't have any kind of, like, I don't have any short-term disability through, you can buy into these things, but they're not going to provide you with coverage that's adequate to actually take care of yourself. I don't have, I pay for private health insurance that is very expensive for very little. And I also, if I were to get sick, well, I can't take clients, I can't interact with everything has to pause. And the thing that is difficult is a lot of the conversations that have been had things that I've heard in the conversations among birth workers is, well, if you don't feel comfortable with it, you can increase your fee. I don't feel comfortable increasing my fee, period. My fee right now is at a place that it's the highest that I feel comfortable asking someone to privately out of pocket pay. It's a place that my partner and I are comfortable with. And we also don't want to set unrealistic expectations of what we can offer for any increased price point. Not to mention, if I increase my fee right now, that's just putting the onus on families who are currently feeling more stressed than they would regularly feel bringing a new baby home. Who knows what's happening to their own income, whether their jobs are stable, whether their housing is stable. We've seen and heard a lot of things from all clients of all different levels of income. And I don't feel the answer is not putting the onus on clients to pay more out of pocket for what? To entice us to risk more for us. It doesn't get to the root of the problem. And the thing that
it's like a misalignment of values. It is not, no one is actually positively co-incentivized.
Right. And the thing that I keep going back to is that the frustration that we're having as doulas in the lack of control that we have right now, in our want to sacrifice ourselves potentially to show up and risk our health and safety for our clients, it's a result of having wanted to make change over years and years and years and years. And I feel like, oops, the buzzer went off. The buzzer went off and not enough had been done by us, by the system at large. And here we are. And now we're having to sit on our hands, and it's really, really difficult and frustrating. But that doesn't mean that we should, now that the door has cracked open a little bit, that doesn't mean that we should now pretend like things are on the up and up and we are safer to do that.
Right. It's interesting. I mean, as you're talking, it also is making me think this thought that I think I've really never thought before, which I'm almost embarrassed to say, which is that doulas are really a product of a very broken system. The fact that we even need to exist is because something is wrong. And it's so much deeper than just a medical system. It is an entire ethos around women's health and women's strength versus fragility, and the abilities of a body to perform birth, to enact birth, right? And then the abilities of our psyche to withstand the intensity of what that physical experience requires of us. And then the ability of our society, our support systems, to then support us in our psyches through that process so that our bodies can be free to birth. It's like it goes out and out and out and out and out, right? So it's this large sort of anthropological disaster, and doulas have somehow evolved out of that as the fix for this broken system. And now, like you said, the buzzer went off, and it's oh, if we're not there, then everything falls apart all of a sudden. Meanwhile, also having to acknowledge that that's only for people who are privileged. It's always been falling apart. The doulas were never the answer for other people who couldn't access that kind of care. And doulas in communities that are disproportionately affected by our medical system, and negatively affected, and by COVID as a result of that, also have doulas who do not earn nearly what white doulas earn. And so it is just this bad cycle that continues to put people back in a position of being on their back foot, right? So what would you like to, yeah.
I think that there's a difference between what a doula is now and what the origin of a doula was. And I think the origin of what a doula was is, I think within the community as it is now, there are people who went into birth work for like different kinds of interpretations of what it means to be a doula. And I think that it is so wonderful and so important to show up for people in labor and birth, to be a community member who shows up for this person and is a source of reassurance and comfort. And there is, there's like a spiritual kind of human connection aspect to supporting someone through birth. And I always like to say, like, if this were 200, 300 years ago and we were living in very different times, I would have stepped in to fill kind of like the medicine woman, like healer type role in the community, that people in my community knew me as that person to do that. And the difference now between that kind of work and the way that doulas are now is that we're contracting out strangers. I don't have relationships with my clients before they pay me money to show up for them. And the work that we do now is much less of normalizing and supporting and providing that reassurance and comfort. And a lot more of it is providing education that should be common knowledge that isn't. And now you're having to cram it all in a small amount of months before your baby comes. It is advocacy and having to stand up and like protect clients from healthcare providers that aren't necessarily, that have lost touch with their own sense of treating others like humans and making sure that they're obtaining consent and that they're offering as much information as a person needs to make a choice for themselves. And that's not, I didn't go into doula work because I wanted to like fight the system. I was frustrated with the system as I knew it, and I knew that that would kind of come with it. But I went into it because I think the transformation of pregnancy to birth and parenting is something I'm drawn to, and I can't help but be a part of it. But the way that things have changed now, it's like all we do is the advocacy piece, the standing up for our patients piece, the making sure that we're always up to date on current evidence, so that when we see something happen that that isn't in keeping with that, we can point it out and we can call it out. And it's tiring.
Sounds so tiring. I did all of my pre-nursing requirements to go to midwifery school, applied to programs, got into programs, and then deferred to travel for a year. And when I got back, as I was reapplying and deciding which schools I was going to pick up with, I started my practice, my birth education and massage and doula practice in California. So I started in a new place, and it took off, and I was feeling super satisfied with what I was doing, and I didn't want to stop doing it. And I decided, you know what, I'm going to do this for a few years and see how it goes. Part of that decision was made after I had a conversation with a midwife at UCSD, where I was practicing as a doula at the time. And I spoke with the midwife while she was, as you do, like she was suturing, and I was down there with her and chit-chatting, and she was teaching me what was going on. And I said, what's your experience like as a midwife in this hospital, as a nurse midwife? And she wasn't much older than me at the time. So she was in her like early mid-20s. And she said, I just had no idea that I was going to be fighting all the time. She's like, the birth work is just amazing. And the political work, and she didn't mean on the global stage or even on the local stage, she meant within her hospital every single day, was so grueling. And she was like, it just makes me wonder where I'm going to be in 30 years of this work. And that had a really big impact on me and what I decided to do with my career, because and that's just such a shame that it goes in that direction where your mentors start to say to you, listen, if for self-preservation, you might not want to do this.
Yeah.
And it means you have to be a warrior. And that's, while the idea of a midwife or a doula, somebody who works in the birth space, and a warrior, I feel like aren't that far from each other. At the same time, they're like totally, that's not how that should be. There should be more of like a surrender and less of a fight, you know?
Mm-hmm. Yeah. I mean, where I'm at right now is that I really struggle with the fact that I know that a lot of the doulas who are going to feel compelled to go back to hospitals soon are the ones who are most worried about their client demographics. Like, who are the doulas that are going to be feeling compelled to show up for their clients are the ones who are taking care of Black families and who are in those communities and who have a harder battle than those of us who are well paid by affluent white Manhattan families. And that's scary to me. It's frustrating to me. And I am at a place where I would rather focus my energy not on my individual, like, how do I get back into the hospital for my clients? I would rather focus my energy on what is this system? How do we change the system that is treating people so poorly, that is disproportionately harming Black people? And how can the conversation move away from how can we get doulas in as essential members of the team to reduce health disparities and bad outcomes, and more toward how can we get the system to treat everyone with proper medical care that leads to good outcomes? And I don't have the answer. It's conversations that I'm having all the time with people in my community.
I read something, somebody text messaged me a message that she'd read on a parenting message board in Manhattan today. And this friend of mine does not work in the field of birth at all. And she said, what are your thoughts on this? And the message was essentially, hey guys, has anyone else had their OB tell them that they're being encouraged to have epidurals during COVID? And if we do insist on trying to have an unmedicated birth, that we should have a dry catheter placed in case we need to get an epidural. And I thought I'd bring that one to you. I was like, wow, that makes my stomach churn a little bit, if I'm going to be honest. I mean, I do understand, if somebody is in bed, they require less physical support. It is easier to monitor them. Nurses can stay in the nurses' station. And so they don't have to be coming in and exposing the patients, and the patients don't have to be exposed to them as frequently. I understand from sort of a logistics and managing of pathology, like vectors, how that might make sense. But it also is fraught.
I also wonder how much that has to do with anesthesiologists right now. I haven't been in hospitals since this started. As soon as I work as a per diem nurse, so I had some choice in how much to work. And as soon as I felt really unsafe there, I decided to prioritize my own health and my life, and find another place in the pandemic for me that wasn't showing up as a nurse. that's a whole other confusing conversation. But so I don't really know day to day what's happening. But I know that anesthesiologists are integral members of all of the COVID response healthcare teams. And they are, I mean, I've been wondering, I at first thought we'd be seeing less epidurals because I thought anesthesiologists would be pulled to other units and labor and delivery would be left with like one. Like I thought it would be, I thought we'd be looking at that kind of scenario. I wonder if that recommendation is coming from that idea that like if they can just get the dry catheter placed when it is convenient and timely for the anesthesiologists, then if things change and if they decide they want the medication to be run, it's a quick and easy thing to do. I haven't had any clients come to me with that, so I don't know how prevalent that is. I don't know if that's just something that's happening kind of in little pockets. But it's tough because on one hand, I think this is healthcare during a pandemic. This isn't healthcare during any normal time. And there are some things that are not ideal that we're going to have to do. I think, laboring without doula support. I think even when partners were not allowed in, there was a part of me that was like, this might be necessary right now to reduce the spread, to keep families healthy for when the laboring people, the new parents go home, to keep healthcare providers safe, to be able to continue to safely take care of laboring people. So there was a part of me that was like, this is pandemic conditions. This is extraordinary measures to just kind of like keep things together while things are really in crisis. And on that, so there's a part of me that is inclined to say some things are not going to be, we can't expect the same outcomes. We can't expect the same experiences, but then there is another part of it that is like, how do you start to pick and choose where that is? And I don't feel that encouraging people to get more medication in the form of an epidural or to default to a choice that they don't feel comfortable with, I don't think that is really the place for, picking. That's not a battle that I would choose. But it's hard. I think there are tons of nuanced things that are happening, small things, big things that we're all going to have a lot of thoughts and feelings about. But I think what I'm looking forward to is on the other side of this, as we start to recover and start to rethink pregnancy care and labor and birth, I think a lot more people have woken up to the idea that more birth options would be really, really good. Out of hospital birth options would be really, really good. I know a lot of home birth midwives who are working on creating more out of hospital birth centers, which is really exciting. I think on the other side of this, we're all going to hopefully stay really fired up about how much more of a spotlight this has shown on racial inequities in maternal health. And I think those are the things that I'm choosing to focus on, and also, continuing to make sure that my current clients and my clients that I will hopefully continue to accrue over the next few months understand how much faith I have in them and how much power they already have. Without me physically squeezing their hips. But that I think moving forward, it's about thinking much bigger than an individual level of doula to client or provider to patient. And in the meantime, I'm having a lot of fun with virtual support. I really am. And that's my frustration with like the eagerness that people have to show up in hospitals again, because I think we were being really adaptive and resourceful and finding really great comprehensive ways to continue to show up for people in a really safe and still impactful way. So I'm frustrated right now with this kind of like break that we have in our community right now between those who are really pushing to get back into hospitals and those of us who are feeling a little bit more cautious and reserved about, more measured in our approach to that.
Well, I'll be really interested to see how it all evolves. It's evolving state by state and city by city and even hospital by hospital. So the Bay Area, New York, and everywhere in between, we just got to keep our finger on the pulse and make sure
I think
that
it's also it's important to remember that I'm talking about New York City, which is epicenter of everything globally at this point. So I'm not talking about even upstate in New York. Things look very different. In the city, in Manhattan, in Brooklyn, things are, in Queens, I have never, this is not, it's something that most of the country has a hard time understanding, because until you live it, until you see it, it's really incomprehensible. The fact that during this call, I haven't had many, many, many sirens in the background is a massive improvement from the way that I had been living. I would say throughout all of March, I would hear an ambulance siren every 3 to 5 minutes. Like, that's not an exaggeration. So
yeah, it's absolutely, like you said, it's incomprehensible. And it's been, unfortunately, such a huge warning to the rest of the country. I guess fortunate that the rest of the country did, at least for some period of time, get behind measures to try to control the spread into other parts of the country. But it's just, what is happening in New York City is so devastating. And in the Bay Area, where a lot of our Glow clients live, we have also had some pretty big numbers. And there've been a lot of measures taken in some of our biggest hospitals, like in the East Bay at Alta Bates Hospital, which is known as the baby factory of the Bay Area. They are still being very, very strict about who can come in. You're getting your temperature taken, every single person is, etc. And it's making, people are having to make some big decisions about who goes into the birth room. And yeah, I really feel for everybody who is pregnant and birthing at this time. And I hope that we can continue to be great support for them as professionals and as community members more casually as well. So yeah, thank you so much today for sharing all of your thoughts and feelings. I know that we'll do this again, and I'm wishing everyone the best.